I think it's really important that you get regular measurements on your pet that are to know what your pet's normal is. If you think for any reason your pet is not feeling well, I think it's really helpful to get a temperature, a heart rate, a respiratory rate, and also a weight on a regular basis. To get a temperature, it's really not very difficult, but you may need some help because obviously you don't know how your pet's going to respond the first time. And if you poke around there in the wrong place, it could be uncomfortable. So I usually do a rectal temperature. I get a digital thermometer from the pharmacy, the same we use on people. Get a rapid one because obviously the faster it works, the less time you're going to spend back there. And very important, I try to get a flexible tip one as well. This way it's more comfortable for the pet. It is a rectal temperature. I've tried all the other kinds. None of them really work reliably. Core body temperature is definitely rectal. So you just pick up the tail and we lubricate the end of the thermometer and you put it in just about an inch and push the button and wait for it to, to beep, and then you have your temperature. And know your pet's normal. A cat and a dog is somewhere between 100.5 to 102.5. So don't be alarmed when you see that high temperature. I don't get concerned until I see temperatures in the 103, 104 range. If you're not sure, it doesn't sound right, if it's too low or too high, then you definitely want to check it again. Low body temperature is also important because that could indicate a really sick patient. As far as getting a heart rate, I want you to get used to feeling your pet's chest and feel what it feels like. Use both your hands and gently wrap around the base of the chest, around the sternum, and you should feel a heartbeat. I also recommend that you come from behind, as in this fashion, and stand from behind, put your hand on the inside of the hind leg, feel their pulse. And that pulse is present in a little groove between the front part of the muscles in the back, it's called the femoral artery, and put your hand on the chest. When you get to know what that feels like, you can actually tell if there's any irregularity in the heartbeat. You can feel if there's any murmurs. So when you put your hand on the chest, you can feel the heart beating. You should not feel a thrill, a vibration, because that could indicate that you have a cardiac murmur, which could indicate valvular heart disease. To measure the heart rate, I usually count the number of beats in a 15-second period, multiply times 4, and that will be your resting heart rate per minute. Similarly, you want to also watch the chest excursions and know what your pet's normal breathing is. When the pet breathes in and out, it should be about the same in effort. You shouldn't see an effort that exceeds in either direction. If they're breathing hard on the way in or hard on the way out, that could mean that there's an organic issue, either with the lungs or the airways, for air to pass down into the lungs. The lungs essentially are a very delicate lattice of elastic material, much like a sponge. So if for any reason there's resistance to that stretching because of fibrosis of the lungs, or if there's any fluid in the lungs because of heart disease or heart failure, or asthma, which is more of an obstructive disease in terms of pushing air out, especially in cats, by the way, that would be a reason for concern.